Let's take a look at several different examples of possible experiential therapies and expressive therapies that you might employ during your intensives. Gestalt therapy focuses on the present moment experience and emphasizes awareness of thoughts, emotions, and behaviors. Techniques such as role-playing, empty chair work, and guided imagery are commonly used. In an intensive therapy session, a therapist might facilitate an empty chair exercise where the client imagines someone or something that they have unresolved feelings towards sitting in the chair. The therapist guides the client in expressing their feelings and engaging in a dialogue with the imaginary presence. Psychodrama involves role-playing scenarios or conflicts from the client's life. In an intensive therapy session, a therapist might facilitate a psychodrama where the client reenacts a significant event or relationship dynamic. If you're offering a group intensive, other group members can participate as supporting characters, and the therapist guides the client in exploring different perspectives and resolutions. Expressive therapies like art therapy utilize various art forms, such as painting, drawing, sculpture, etc. As a means of expression and exploration, in intensive therapy sessions, the therapist might incorporate art therapy by providing materials for clients to create visual representations of their emotions, inner conflicts, or experiences. The therapist then facilitates a discussion around the artwork, helping the client to gain insights and process their feelings. Music therapy involves the use of music and sound to address emotional, cognitive, and social needs. In an intensive therapy setting, a therapist might integrate music therapy by inviting clients to engage in activities such as songwriting, improvisation, or listening to specific pieces of music that resonate with their experiences. The therapist then facilitates discussions about the emotions and the memories that are evoked by the music. There are, of course, more options available beyond these four. What might suit your clientele? What suits your style? These are additional ways that you can differentiate yourself from other practitioners. Remember, we mentioned in earlier modules to connect with other businesses? This would be a good time to consider if you have any local businesses that offer any of these types of activities that might make for good partnerships. We know some of these ideas may seem out of the box, but hey, many of you might be out-of-the-box practitioners. So as long as you are ethical and you follow appropriate guidelines to protect yourself and your clients, get creative. Take a moment now to look over this list and jot down any of these that stand out to you or ones that you might want to investigate further. When you're ready to introduce a new experiential or expressive therapy to your client, you can make it the best experience by following these simple steps. First, rely on the pre-intensive assessments. Your preferences and therapeutic goals that you've collected from the client prior to the intensive can really help you tailor their experience. At the beginning of every session, do a feelings check with your client. Be present and aware of their needs by checking in with them. As with all therapeutic approaches and modalities, you and your clients want to prioritize self-care and emotional resilience. Start your experiential work slowly, with a light version on the first day. If they respond well and you'd like to do more, you have 2 and 3 days more. Different clients may respond differently to various interventions, so you should be prepared to modify approaches as needed to meet their individual needs. When you introduce new activities, it will help your client feel comfortable if they have adequate training, clear guidelines, and established boundaries. As your clients explore sensitive and challenging material, you will want to be prepared to provide emotional support.